This is a ongoing study on how to engage Masters of Public Health students within a an environment that actually is quite difficult in terms of getting them service learning experiences. Post-COVID, things have changed, and the landscape isn't the same with regard to service learning. However, we have a problem. And so the background of this study is that public health students need experiences to actually ensure that they can take their theoretical knowledge and apply it directly to real world experience. They need opportunities to be able to practice behavior change methodologies. They need real world experience to be able to practice their epidemiological experiences. And also the biggest one is that employers tell us that students need soft skills. So when they get into the workplace, they actually need to know how to communicate and how to work with people from diverse backgrounds, diverse cultures, and that have idiosyncrasies that are different from theirs. And so this has become a challenge for those of us as in terms of public health faculty. So in this particular study, what we decided to do was look at using blog writing as a teaching strategy. And to also use it as a strategy to help students develop some of those additional soft skills while actually providing a meaningful service to the community. So we know from the research that blogs are a great way for students to communicate effectively and share ideas in ways that they would not normally be able to do through written assignments or papers or exams. We also know from the research that they can help increase student engagement and be more interactive both with their peers as well as the university, as well as providing a positive learning environment for each other. And we also know that there's a lot of the health information available online. And so blogs and blog writing can be a really meaningful way to disseminate a research-based health information to the community. So for this particular study, the research question was, does integrating this type of service learning through article writing for community effectively enhance public health students' abilities to educate and engage the local community? So just a little background information. Fort Valley State University is located in Middle Georgia. We're about 2 hours south of Atlanta, and we are mostly an agricultural community. Really, the entire area is agricultural. And so we're a land grant organization, land grant institution, and we are located on a campus that has the most land out of all universities in the state of Georgia. So we're pretty much a rural environment, and that means we're pretty small knit. And so that also means that we typically are missing resources that maybe other larger schools or schools that are within urban areas have access to. So this presented us with an opportunity to be able to create our very own community wellness website. And so as a professor in the program, I developed this website called Fort Valley, which is the name of the city we're in, Fort Valley Community Wellness, and it's fortvalley.wellness.org. And so this website hosts about 10 pages, and each of the pages hosts blog articles that are written by specific classes. So as you can see in this image here, there's a page called Eating Well. And that page is a page that is predominantly written by students in the health and behavior class. And then there's a page called resources, which is predominantly written by students in the introduction to public health class. The health data page is written by students in the epidemiological and biostatistics class. So each semester, the pages have articles that are added to them based upon the new class enrollment. And so this is a project that I started back in 2022. It's a qualitative observation design. And the participants are only students that are enrolled in those particular classes. So from 2022 to 2024, we've had a total of 63 articles written from 37 students. So you'll see, you can notice that several students wrote more than one article. And of course, that is because they've taken more than one class with me. And so depending if they perhaps took intro to public health one semester and then took health behavior the next semester. So they have 2 articles that they have submitted into the website. The analysis that I used for this was twofold. For one, the articles produced by the students, and they went through a content analysis, but then they also had to go through an academic evaluation. And so both of those twofold assessment made sure that the articles that were published were appropriate for public consumption. So they were appropriate in terms of language, they were appropriate in terms of cultural sensitivity, they were error-free, all of the references were there. So they kind of went through that kind of rigorous background. The other side of this is that there had the community had to provide feedback. So on the actual pages of the blog articles, community members who viewed the website and went to the website for information left comments about each article. So that gave us some additional information with the utility of the website. So there are some limitations in this type of service learning activity because basically, it's a purposeful sample and there's some subjectivity in terms of the article evaluation, of course. And it's difficult to know whether or not the changes that we saw in the attitudes from the community members and from the students were a direct result of the service learning intervention, or perhaps it was just from them gaining additional knowledge as they were doing research on the topic. So here is an example of one of the articles. This is a student who's graduated, and so her topic was, what is eating healthy? And so she designed a PowerPoint, which was embedded into the website. And then we also have the students post their bios with their pictures so that the community members got to know who was actually writing these articles and what their backgrounds were. And that appears to have made quite a difference. Some of the comments from the community members are, and I know this is probably way too small for you to read, so I'll just give you the highlights. One community member stated that as a busy parent, the health blog crafted by the public health students has been a lifesaver. I can easily find articles on family-friendly meal ideas, health advice tailored to our busy lifestyle. It's become my go-to source for keeping my family healthy and happy. Another community member wrote, thanks to the blog site, I've discovered so many local treasures in our community, from farmers markets to fitness classes. It's inspired me to explore and take advantage of the resources available right in our backyard. And lastly, another community resident wrote, the blog authored by the public health students has truly become a cornerstone for our community, bringing residents together to prioritize their health and create a happier, healthier environment. It's an invaluable asset that I'm grateful to have. So we got some really great comments from community members regarding the utility of the website. Of course, the goal of this project was to try to incentivize change within the students. and to ensure that they also gain some skills from this. So some of the comments from the students have been that through writing for the blog, I've had the opportunity to explore different areas of public health and develop a more holistic understanding. Another student wrote, the website has allowed us to connect with our community in a meaningful way and build trust as reliable sources of information. It's gratifying to know our articles are helping to bridge the gap between the public and the healthcare system. Another student wrote, writing for the health blog has challenged me to think critically about public health issues from diverse perspectives. So I'm sure, as you can tell, as a public health professor, I am quite pleased with the responses from both the students and the community members. During the content analysis, 3 themes emerged: that the students and the community were able to grow personally, and the community felt empowered, that there's impact by providing students with an opportunity to talk and serve directly with the community, and that we're building trust and credibility as an institution, as a program with the community, which can be difficult in a college town. Sometimes the college seems separate from the community. So we were very pleased with these results. There are some considerations that should be had in designing a program like this for service, including service learning for a blog site. You do want to be sure that there are clear objectives, that you are able to evaluate and assess properly, and that there's some community partnerships in place so that students have access to resources to go out and find information to post that is reliable and that is research-based. And of course, be flexible and to be adaptive. So just in closing, the students in this project were able to provide the community with a need that was beneficial, while also being able to hone their own communication and soft skills, as well as helping them in their own career advancement strategies. Thank you all for listening, and I'll take my questions at the end.